Squats are a common strength and conditioning exercise that are used for improving strength and power. The prime movers in the squat are the erector spinae, gluteus maximus, quadriceps femoris, which includes rectus femoris, vastus intermedius, vastus lateralis, and vastus medialis. Also includes the hamstrings, which are semitendinosus, semimembranosus, and the biceps femoris. Following this, they would be called quads and hamstrings. The synergists and stabilizers are the transverse abdominis, gluteus medius and minimus, the adductors, primarily gracilis and adductor magnus, and soleus and gastrocnemius. Ultra fitness and training and functional anatomy, no date. All joints below the belly button, the hip, knee, ankle and foot, and most of the spine need to be stable and mobile to squat properly. If any of these areas are unstable or immobile, they can modify body motion and adversely affect the quality of movement for the squat. Palestranga and Soames 2009, Escamilla 2001. There are 3 phases to a squat. The movement involves both internal and external forces. The active internal forces are created by the contraction of the prime movers, which generate a pulling force via their attachments to bone. The passive internal forces are the tension generated by the connective tissue of the joints and muscles. During the squat, the load of the barbell supplies the external force. For this movement to be executed properly, many levers within the body need to work together. Any changes to the angles of these levers can improve or worsen the squat. Hamel and Knudsen, 2009. We are looking at a comparison of 2 squats, one performed well by Jess on the left and the other performed poorly by myself. The squat is performed with the barbell on the back below the level of the acromion and starts with the individual in the upright position with the knees and hips fully extended as is shown. The individual then squats down in a continuous motion until a desired squat depth is obtained, and then in a continuous motion ascends back to the upright position. Let's have a look. According to Palestranga and Soames, 2009, during the starting phase, the ankles are dorsiflexed. The knees are fully extended with the quadriceps relaxed. The hips should be in the neutral position with slight lateral rotation maintained by a slight contraction of gluteus maximus and the hamstrings. Although you can see from this that my hips are anteriorly tilted. And the spine should be in a neutral position. As you can see, the lordosis and kyphosis is being shown. During the downward phase, the knees are unlocked by the popliteus pulling on the lateral femoral condyle, rotating the femur laterally and sliding the medial condyle forward. The knee then flexes under the weight of the body and the bar and is controlled by eccentric contraction of the quadriceps and gluteus maximus. The quads also eccentrically contract to control the knee integrity as it bends. Usually these muscles act as antagonists, but in this closed chain exercise they act paradoxically and contract together. This synergistic action helps to neutralise the anterior shear forces on the tibiofemoral joint, thus decreasing stress on the ACL. Schoenfeld, 2010. The ankles are dorsiflexed by the weight and the change in the position of the tibias. The gastrocnemius and soleus act eccentrically to control the movement, making it a dynamic stabiliser. The arches of the feet are maintained as the weight transfers to the metatarsal heads and the pads of the toes. All muscles crossing the ankle and feet are working to maintain balance. The hips are flexed due to the forward flexion of the trunk, which maintains balance and is controlled by eccentric contraction of glute max and the hamstrings, making them antagonistic stabilisers. Palestranga and Soames, 2009. Exercise prescription net, no date. The third part of the squat, which is the rising phase, involves a concentric contraction of the quads, with maximum force being applied when the knees are fully flexed. This decreases as they extend. At full extension, the knees move into the closed packed position as the femur rotates medially on the tibia and the medial femoral condyles slide backwards on the tibial plateau. Hall, 2012. As the knees extend, the soleus and gastrocnemius contract to cause ankle plantar flexion. Glute max and adductor magnus contract to extend the hips, and the spine is extended and stabilised by erector spinae, while the rectus abdominis and obliques act as antagonistic stabilisers. Exercise prescription, no date. When we lift the barbell and move through the phases of the squat, there are many force vectors involved, or directions of force, acting in and around us. Gravity is one force that is pulling on us. Ground reaction force is another, and is an example of Newton's third law. This means that the force being applied by our feet is met with an equal and opposite force from the ground. We have muscle forces within the line of pull from the origin to the insertion, and we have the forces of momentum. The outcomes of a movement is the sum of all vectors and their respective forces. PT Direct 2015. A moment arm is the length between a joint axis and the centre line of gravity acting on that joint. Every joint that is involved in an exercise has a moment arm. In the poorly performed squat, you can see the moment arms around the hip and the knee. They measure from the joint axis to the line of force. With this bar in this position, the moment arm around the hip is slightly longer than that around the knee. This means the hip extensors, the glutes, will be doing slightly more work than the knee extensors or the quads in terms of the force they'll need to generate to overcome the load. PT Direct 2015. Looking at the poorly performed squat, we can see that I am not maintaining a neutral spine and that there is a great deal of flexion of the trunk from the hips. Compare my angle to Jess's and you can see she is maintaining more of a neutral spine. Fry et al. Noted that lumbar shear forces increase with a greater forward lean and that less skillful lifters like myself tend to do this. McGee also states that compressive forces on L3 increase by 150% during a forward bend. McGee 2014. Other obvious biomechanical flaws with the execution of the movement are excessive flexion of the thoracic spine with abducted scapulae and an increased lordotic curve of the cervical spine. Precision Nutrition 2015. Zhaprovsky et al. 2003 state that by starting the squat movement with flexion of the knees, shearing and compressive forces are increased on these joints, which may cause overload, leading to injury to the cruciate ligaments or faster degeneration of the femoropatellar joints. During the squat movement, I start the movement at the hips. Take note of the video. Which is correct. I move my body mass backwards and lean the trunk forward, which is also correct. But what I'm actually doing is more of a forward bend. If I were to maintain a neutral and stable lumbar segment and a slightly straightened thoracic segment, it would minimize excessive shearing forces and compressive forces on my spine. Because of this poor form, I'm placing excess strain on my erector spinae muscles, iliocostalis, longissimus, and spinalis, as they are critical in resisting vertebral shear forces. Precision Nutrition 2015. In conclusion, strong and stable knees are crucial to athletic performance or to a patient's successful recovery from injury. As such, an understanding of knee biomechanics while performing a squat is helpful to physical therapists, trainers, sports physicians and coaches to help facilitate better training outcomes or rehabilitation for patients.